Mama, my name is Dr. Allie Capps and I'm the pelvic floor physical therapist and owner of Bell Therapy and Wellness. So one of the first questions I always get is, what is a pelvic floor physical therapist? And that's honestly a very good question. So this is just a type of physical therapist that takes additional courses and has additional training in pelvic floor dysfunction and how to rehabilitate it. Pelvic floor dysfunction can happen to either gender and across the entire lifespan. So yes, there are pediatric pelvic floor physical therapists out there, and they can help children with things such as chronic bedwetting, chronic constipation. There can be some kids who experience pelvic pain and a wide range of other dysfunctions. I do not specialize in pediatrics. I actually specialize in helping the mamas. So one of my favorite demographics to work with is the mama that's in their early or even later in postpartum. And it doesn't matter if you had a baby 10 years ago or if you had a baby last week. You are in the postpartum phase of your life. So just to show you a little bit about what I'm talking about, I have my anatomy model here. So the pelvic floor specifically, if you are looking down into, this is a female pelvis, you can see that this kind of like reddish burgundy, these are muscles that attach from your tailbone and your sacrum, and they wrap around and attach to this bone of your pelvis. So as you can see, this is quite a bit of musculature. And if you look at it from the opposite view, once again, you're looking at this is on different layers. So there are 3 layers to the pelvic floor. And then you can obviously tell this is a female model. But if you can imagine, this is quite in depth. I mean, because not only are you looking at the layers of muscles, but obviously these muscles are innervated by nerves. There's blood supply. You have the organs that are sitting here supported by these muscles. The pelvic floor is very complex. And in my personal opinion, I think it's one of the most overlooked part of the body, especially in women. I don't know how many of you are referred to pelvic floor physical therapy after your childbirth, but I believe that it's extremely healthy, and honestly, it's very vital to even just get examined, just to see, okay, where am I in the grand scheme of things? Are these symptoms I'm experiencing normal? Or are they just common and maybe people are telling me they're normal, but they're not actually normal? So I wanted to go over a few signs that you might have some pelvic floor dysfunction going on and that you would benefit from seeing a pelvic floor physical therapist. These can be things such as urinary or fecal incontinence, chronic pelvic pain or even acute pelvic pain, pain with intercourse, that one definitely counts. If you're having any numbness and tingling down there, especially with just sitting for too long, that could be a sign of pelvic floor dysfunction. And then last but not least, if you're experiencing some sort of heaviness sensation, so if you feel a heaviness, especially at the end of the day, that centers around your pubic and pelvic region, that can oftentimes be a sign of pelvic organ prolapse, and that is very easily treatable by a pelvic floor physical therapist. So once again, remember, any sort of incontinence, pelvic pain, numbness or tingling, prolapse signs, so the heaviness, maybe the feeling that something's falling out, anytime you have difficulty going to the bathroom or emptying your bladder completely. And then if you're one of those people, especially in postpartum, where you feel like you're going to the bathroom every 5 minutes, that can also be a sign that you need to see a pelvic floor PT. And honestly, I think it is wonderful to even just seek the counsel of someone in person, but unfortunately, that's not always the case, and some people do not have that accessibility in their hometowns. So honestly, I think it's great if you can go see a pelvic floor physical therapist in person, but the reality is that it's very hard to do. It's very hard to take your baby and the stuff and go in there and do the things that you need to do while taking care of an infant. And then a toddler is a whole other ballgame. And then B, pelvic floor physical therapists are unfortunately still rare. If you live in a bigger city, you're more likely to have one, but if you live in a smaller city, you may unfortunately not have one easily accessible to you. So I'm working on an online course that helps lead women through a pelvic floor and core rehabilitation program. So there'll be modules of me, educational modules as well, going over some of the whys and tips on breastfeeding posture and how to prevent the pain, how to lift without pain, how to hold your baby without feeling excessive pelvic pressure. Because unfortunately for us as moms, whenever we have a baby, our life doesn't stop and our life doesn't slow down. So we need to be able to take care of ourselves while keeping up with our baby. So if you're interested in this online accessible course, check the description box below. There should be instructions on how to either find out more information about it or a link directly to go to it. If you have any questions about whether or not you are appropriate for this course, you can go to the frequently asked questions on my course website, or if you would like to reach out to me directly on my website, which is www.bellknoxville.com, there's a contact form. I would love for you to write your question or statement or concern in the box, and that gets emailed directly to me. So whenever I reply, it will be a direct response from me. But if you have any questions or concerns, I would love to be able to answer them and to help you personally. So please reach out. Please go check out the course. I hope you found this video helpful. And if you do need a pelvic floor physical therapist, please don't panic. It's okay. There is help that you need out there in the world. And mama, don't put off taking care of yourself.